Tuberculosis is characterized by the formation of tubercles or tuberculose, granulation, and caseous necrosis in tissues. On the other hand, tuberculous peritonitis is the fact that tuberculosis can spread to the peritoneum through the gastrointestinal tract via mesenteric lymph nodes or directly from the blood, lymph, and fallopian tubes. Some of the symptoms are abdominal swelling, fever and night sweats, anorexia, weight loss, and abdominal pain. The most common medication used to treat tuberculosis include isoniazid, rifampin, ethambutol, and pyrazinamide. If you have drug-resistant tuberculosis, a combination of antibiotic called fluoroquinolones and injectable medications such as amikacin or capreomycin are generally used for 20 to 30 months. With the global resurgence of tuberculous peritonitis, it has become a significant health concern not only in endemic areas but also in the United States and Western Europe. The annual worldwide decrease rate of mortality is approximately 3% and 2% of incidence. The annual rate of death because of tuberculosis is 16%.
TB is an infectious and contagious disease caused by a bacterium called Mycobacterium tuberculosis. TB represents a truly global threat. Up to 1/3 of the world population may be infected with or has been exposed to tuberculosis. Anyone can be exposed to or get TB. This disease is transmitted or spread from person to person through droplets of saliva or mucus expelled during a sneeze, coughing, shouting, or singing, as this may contain the TB bacteria if the person has the disease in its active stage. If a healthy person breathes in these droplets, the mycobacteria can lodge in the lungs. It can also migrate via the bloodstream and affect other organs, such as the skin, kidneys, spine, meninges, or the urinary system. TB is not spread through contact with personal items, clothing, or through shaking hands. People most susceptible or at greater risk of contracting the disease are people with weakened immune system, patients with HIV/AIDS or diabetes, smokers, the elderly, patients with organ transplantation, and alcohol and drug users. An additional risk factor may be presented when people are exposed to frequent, prolonged, and close contact with persons who have active TB. The first symptoms of active tuberculosis are poor appetite, weight loss, cough that may be accompanied by bloody sputum, variable fever, night sweat, chest pain, and fatigue. If you or someone you know has any of these symptoms, or if you have been in contact with someone who shows the above-mentioned symptoms, it is important to talk to your doctor or go to your nearest medical facility. TB can be diagnosed with a simple skin test known as the Mantoux reaction or tuberculin test, a series of tests that may include a chest radiograph and samples of blood and sputum can be used to determine TB infection as well. TB is treatable and curable. Once diagnosed, it can be addressed through a series of specific antibiotics. Talk to your doctor when planning your treatment. It needs to start quickly to increase your chances of overcoming TB. Make sure you understand their instructions and get answers to your questions. Treatment can last several months. It is very important to follow it strictly. Even if you feel better, it is no reason to stop your treatment. You must complete it as indicated by your doctor. Failure to comply with treatment as indicated can cause the mycobacteria to become resistant to antibiotics. This can make TB more aggressive and dangerous, a condition known as drug-resistant tuberculosis. To prevent the spread of infection, maintain good nutrition and drink a lot of fluid to stay well hydrated. Attend regular health checkups with all family members. Avoid staying for a long period of time in a crowded place. Avoid drugs, alcohol, and cigarettes. When you cough or sneeze, cover your mouth and nose with a tissue or your arm. Also, use a face mask when possible. Let's all take these preventative measures to stop the spread of TB.
In order to fight this disease, people should be aware of what it is about, which are the common symptoms, and what should they do if they get infected. Hospitals and universities should spread information about tuberculosis and the secondary diseases it can bring.